My condition's been lifelong. I was basically born with digestive issues that have just exacerbated. In the early 90s, I had a blocked intestine. Things went downhill from there. I was put on a medication called Reglan, and that created neurological issues. I now have esophageal dyskinesia. They had to wrap my esophagus because I had a growth in it that's considered premalignant. That created other issues. I ruptured out, and they had to patch 4 hernias once, and then they gave up and patched the entire abdominal area. That has since now hardened. It's been recalled, but it cannot come out. It's like having a metal corset on. The esophageal dyskinesia, they have to treat with Botox injections every 6 months. The marijuana helps it relax. It enables me to swallow. When I use the sprays with the vapor and things like that, it also relaxes. I also have tardive dyskinesia from the Reglan, so it helps relax that. When you get to the stomach issues, that's paralyzed. I have gastroparesis, so it creates contractions, which my understanding is that's what the munchies are. It makes your stomach contract, and so that helps me have an appetite, makes me hungry. There are various strains that I use for hunger and strains I use for pain and relaxation. When you get to my gut, I also have dysmotility of the bowel, and it's paralyzed, and that has evolved into a prolapsed rectum. So the pain involved in all of that, the marijuana helps tremendously. I'm allergic to opiates. I can't take morphine, I can't take over-the-counter ibuprofen, I can't take codeine, I can't take any of those. Even Tylenol can bother my system and disrupt it. Medical marijuana is all I have. And so far, when I first got my license, that was in June, I was down to 98 pounds because of all this. I'm back up to, I waver between 104 and 106. So in my mind, I gained 8 pounds.
Yeah, that's huge.
And that was within a month. And I'm hungry. So, yeah, and I'm not grimacing. You're not seeing the grimace that most people see when I'm out in public. So that's a huge relief for me, because people don't take it well. They think I'm angry. And I'm not an angry person at all. So, they were telling me if I don't get some calories in me, last October we all agreed I had about 18 months based on my rate of deterioration. I'm what you call chronically wasting from all these neurological issues. Now it's evolved into lack of muscle, so tendon issues. I used to make jewelry. I did that until about a week ago. I finally gave it up. I'm having to shut down my business. I'm too weak to do the shows, to sell it. I'm too weak to get out there to do the shops and things, so that's all I've got left. You know? I'm a Kaiser patient. My doctors are not allowed to sign the apps. They flat out tell me they're afraid they'll lose their license over it. And again, that's something I'd like legislature to look into, because it's discouraging the doctors. They're all for it. It's in my records, and they're all for it. I have a team of doctors working with me, a rheumatologist, a GI, a surgeon, and a primary care, and a mental health therapist. Every one of them backs it 100%. In fact, they were thrilled when I got my license, but I went through a friend's reference and met with their doctor. She spent 45 minutes with me. She turned down 3 people ahead of me, so I knew she was legitimate. And she got all my records that I brought with me, and we went from there. And within a month, 8 pounds was on. I'm real impressed with the way the dispensaries, the legitimate dispensaries, are set up, because I have seen some that I was not impressed with. If they could look at that and do some more studies, do some testing. I'm hearing even autistic children are being helped. So they need to do some more studies. They need to encourage the medical field to back it. The ones that are backing it are afraid to do anything other than just say, oh yeah, I think that'd be good for you. They need to encourage them to get out there and sign the applications and encourage their patients to try it, especially in a state like Colorado where it's okay, where it's available. And for what it's worth, I'm using it as tax write-off. I used the receipts to get my mortgage modified as a medical expense. The mortgage company took every one of those receipts into account. So this is, it's a medical thing, and it's not just me wanting to be a stoner. Sativas, because of my neurological disorder, I had to learn this. Sativas tend to make it more intense. I go haywire. I get my heart racing. My understanding is it works on the cerebral part of the brain, therefore the sense of euphoria, and it's like speed for me. So I have to stick with the heavy indicas because I need to relax. I've got muscle spasms and esophageal spasms and so on. So I need to be able to relax all that. And the heavier the indica, the better.
And the pain too, probably.
Pain, definitely pain. It's nausea. I have, motion sickness. It controls all of that. I wouldn't have been able to ride in the car to get down here today. The other thing they should know is it's Western medicine is why I'm in this condition. Pharmaceutical medicines and things like that I have been told, oh no, you can no longer have. And that's why I'm here. If I'd had the marijuana legally as a child, maybe a teenager even, some of this stuff might not have evolved into what it's evolved into. I've had 21 surgeries because of all this. And a lot of my issues are because of all the surgeries. And I don't think it would have happened if I were allowed to use it legally. If they would legalize it, people like me would have a shot. This has been a lifelong issue. And I know I self-medicated as a teenager and a young adult, and I'm to the point now where it is the only thing I have. And they need to look at it in that regard and not consider it a drug. It's an herb. It shouldn't be lumped in with the drugs, the chemicals, and things like that.